I feel really bad.
Okay.
Oh, 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 oh.
I want to check your blood pressure. Are you in pain? Hello?
Oh, 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 oh,
Okay, I will check
oh.
your sugar level. What should be the
It's 7.8.
so, can you say your name? Okay, the patient BP is very down. I need to give him some fluid.
Two minutes remaining. Move on to the next station.
Okay,
Okay, yes.
you tell me yes. Don't ask me yes. What did he do?
I just need someone that just perform one time so I can observe and just know.
Okay.
This is my life.
Okay, now let's start with Ibrahim. Okay?
Yes.
What I should do? I should do submit or feedback.
This all the day was a feedback on this, so he does not know anything to do.
Okay. I should. So
Yeah. Okay.
for this case, for this particular case, he came into the station. I didn't read the question, but she told me he's confused patient. So normally for Simman, you come into the station, say your name, your exam number to the examiner, and then say that you observe all universal precaution because this is emergency situation. So you see the patient ABC. A, we call the patient is not responding to you, Mr. I don't know the name of the patient. Then tell him, you verbalize that my name is Ibrahim. I'm one of the doctors here in the emergency department. I'll check your wristband for your name. Okay, I can see you are Mr. John. Mr. John, can you hear me? Can you hear me? No response. But yeah, he answered you. So my patient is speaking to me. So I assume the airway is patent. That's he.
Yes.
Mr. John, I'll be looking at your monitor now to see how well you are doing. I'll be with you just to reassure the patient. Look at the oxygen. When he came in, the oxygen was good. I think it was 97, 98. I can't remember. In the beginning, it was okay. Then later, I dropped it. Okay, so, but if it is okay, yeah, maybe 98, 99, your oxygen level is okay at the moment, but I'll keep an eye on it. At this point, I will check your chest, okay? Then you go to B. But if the oxygen was down, we tell him, okay, your oxygen level is low. Do you have a condition called COPD? It tells you yes or no. If yes, then you give him oxygen through the ventral mask. If no, you give through non-rebreathable mask. And he told us that you have to say anything we give patients in the emergency room, we say the dose and then the route. So you give him oxygen via non-rebreathable mask, 15 liters per minute, 100% oxygen, non-rebreathable mask, 15 liters per minute. Now we assess you as you move on. So you give him an oxygen. Tell him, Mr. John, I'm here, going to be with you here. I just want to pick the oxygen. And pick the face mask. Can you lift your head a little bit for me? Just IPS. Lift his head, put the oxygen. The face mask can connect it. Then move to B. Now I'll be checking your chest. Just you can do it without saying, but for me to remember, I try to verbalize what I'm saying. So expose the chest, you look at the chest. Okay, you feel that's you touch the patient's chest, airway, breathing and everything. I don't know what the case is. If you listen, there might be something there. Then maybe there's crepitation or there's wheezing, depending on what is there, then that will determine what you do next. In this case, again, I don't know, but it looks like sepsis patients because if you look at the monitor, there was some.
There was a high temperature.
Yes, there was high temperature, there was everything, but
Blood pressure was low.
then you move to C. If there is no problem in B, move to C. All right, Mr. John, I would press on your finger now, check capillary refill. I will check your pulse. So we do the pulse. Here, he told us to check the peripherals only. No need to go for central. Just the peripheral. Go here, and then go to the limb. Okay, and then so once you are done with that, the peripheral pulses, then I'll tell him that okay, I'll be putting a cannula, a flexible tube to your vein, so I can give you medication or fluid when needed. Then you go and pick your fluid, your cannula, and put it beside the patient. Okay, then he has advised us that you check for temperature in C. But something that is important here is that okay, since temperature is high, you put the fluid, you put the cannula, you tell him you take your blood, you take your blood, okay, for some investigations. Importantly in sepsis, you must say for blood culture, you must say for lactates as well. If you do ABG in the first place, in B, then definitely lactates will be part of the ABG. So you will take your blood for blood culture and then for lactates, and then from some other investigations. So then, because you are in C as well, check the pulse, check the blood pressure. Okay, look at the monitor. I can see that your blood pressure is low, is on the low side, and the heart rate is high. Okay, I will start you on fluid. So you pick your fluid here, normal saline, 500 ml. But again, you have to verbalize the dose you are giving. So I'll give you 500 ml of IV fluid. Patient might not know, but can verbalize his IV fluid, and then I'll reassess you. Okay, after about 15 minutes thereabout. So you just say, okay, I'll reassess you thereafter. You put the fluid. If it's not improving, you have to repeat it, but not immediately. You have to wait a while. So that is the thing you do in C. Now, because temperature is high, I can see your temperature is high. I'll start you on antibiotics according to hospital protocol. This is just broad-spectrum. And I'll also give you something for your temperature, paracetamol. Okay, those are the things you do in this C for this patient. Then you already are suspecting sepsis. You want to look for where is the problem. So if you suspect something, look for the because maybe it's in chest. If you find a chest or he has catheter, for example, something like that. So once you are done with C, then you move to D, disability. D, that's when you're checking the blood glucose. You understand? So in this case, you check the pupils. D. On AVPU system, that's the first thing because you are checking the CNS, AVPUs, consciousness, and then the pupils. So on AVPU system, my patient is verbalizing, so he's alert. Okay? AVPU. Yeah. So is hey, once it's on A, you're okay, you're good to go. My patient is alert, he's verbalizing, he's talking to, so he's alert. So then check the pupils. I'll be shining light through your eyes now, please bear with me. Check the pupils. Okay, it's okay. Then check the blood glucose that you did here. I'm sure this is not because blood glucose is 7. Alright, so then you move to the, E, everything else. So everything else, do 8 to 2 examination. At this point, I'll check you from head to toe. You check for any rashes. Just do quick, for me, just do quick examination, general physical examination, any rashes. I would have loved to turn your back to see if there's anything going on. It might be sepsis, it might be wound that he has there. He's been on admission for a while. I don't know the case, but just do that. And then if they say talk to the examiner, then you go to the examiner, talk to the examiner. I was called to see Mr. Johnson, who was noticed to have developed, who was admitted as a case of blah, 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 He's a 75 years old man with background history. Was noticed to have developed confusion. When I assessed him, his blood pressure was this, I gave him this. At the moment, he's stabilizing or his vitals are okay. Moving forward, I've sent sample for blood culture, urine analysis. I've given him lactates, I've given him oxygen, I've given him IV fluid and antibiotics. Sepsis 6. We discussed that. And then according to hospital protocol, we might have to adjust his antibiotics. Okay. If you know the focus, you can document that as well.
Okay, I think better we start with you so that others can see.
Okay.
Uh,
Bodies are not coming. Do you have their numbers? The other people?
We don't have the numbers.
okay.
Okay.
So you need to follow ABCD. Okay. So start with the A, B, C, D, E. Okay. So there was no order at all. In terms of the assessment, you could talk to the patient. Patient was talking. Start the high flow oxygen stuff. Okay. So the next scenario that we have is.
Those online candidates cannot see this.
Yeah, they can see it. Okay, so you can join either online and have a look at what the scenarios is.
Okay.
Yeah.
No, I need to know them. Oops, internets. There's no
Join
internet.
practice session.
Yeah.
Join the session.
Yeah.
Can you read it?
Not extremely.
Are you able to read? You don't need audio.
The cross it. The cross.
It's not.
No?
I think the network is not. The internet connection is not.
Okay.
For me, I'm using the internet here and I cannot join.
It's okay. You can come and read it.
But the people online cannot see.
Oh, wait, wait. It's okay. There's a problem with the internet.
Yeah.
It's okay. We are still recording in the device. So. Okay, so this is your scenario. You can read it loud for everyone.
Mr. William Smith, age 69, has been admitted with complaint of shortness of breath and difficulty in breathing. Your FRI2 doctor in Akit Medical Unit. On the background, Mr. William Smith reports that has been feeling shortness of breath for some time. You are called to see this patient. Please talk to the patient, assess and manage his ongoing problem. At 2 minutes warning, discuss the management with the patient.
Begin.
Shodipo Ibrahim 7931569. Hello, Mr. Williams. Hello, can you hear me? Hello, Mr. Williams. Okay, my name is Ibrahim. I'm one of the doctors here. Okay, I'm here to attend to you. Can you hear me, Mr. Williams?
He can't breathe.
Oh, so sorry about that, Mr. Williams. At this point in time, I'll be listening to your chest. Okay, I have some. I'll connect you to the monitor to look at your oxygen and your respiratory rate. Mr. Williams, your oxygen level is a bit low. Do you have condition called COPD?
No.
All right. Okay, I'll be getting some oxygen for you now. Okay. Okay, I'll be giving you oxygen, 100% oxygen via non-rebreathable mask. Can you lift your head a little? All right, Mr. Williams.
Thank you.
You're welcome. All right. You're going to feel much better in pretty time, okay? A little time now, all right? So I'll go ahead to continue checking you. My patient is verbalizing, so I assume the airway is patent. I'll be listening to your chest now, okay?
Thank you.
All right. I'll look. Okay. I'll be touching you now, okay? All right. Can you take a deep breath for me? Good. Okay. All right. I can hear some abnormal breath sound. Okay. At this point in time, I'll be giving something to relieve you. All right.
Thank you.
Okay, Mr. Williams. Okay. No, I just leave that for now. All right. Mr. Williams. At this point in time, I will check your pulse. Okay. I'll be pressing on your hands.
Thank you.
All right. Okay. I'm checking your pulse now. Okay, your pulse is a bit fast, Mr. Williams. I'll be connecting you to the ECG monitor to see how well you are doing on your heart. Okay, heart rate is higher as well. Okay, I'll set a line for you now. I'll put a flexible tube through your vein. So this will allow me to give you some medication as we move on. Is that okay?
Thank you.
All right. All right, yeah, Mr. Williams, your respiratory is a bit higher as well. I'll listen to your chest again. Looking at your blood pressure is a bit on the low side. I'll give you something for that. Is that okay?
Yes.
Thank you. You should get better in a little time, okay? How do you feel now, Mr. Williams, about your chest?
I feel better now.
All right, okay. I'm here with you, all right? Okay, I'll be checking your blood sugar and I'll
I
look
don't
into your eyes
feel
now.
well.
I'll be shining light into your eyes now.
Equally reactive.
All right, thank you. And I'll check your blood sugar as well. Yes. Mr. Williams, your saturation is a bit dropping at the moment. So I'll
I don't
reduce.
feel well.
So sorry about that. I'll reduce your oxygen now. I'll change your oxygen now to
I
a
don't
non-refusable
feel
mask.
well.
To a nebulization mask rather. Sorry.
Two minutes remaining.
Okay. I'll be giving you salbutamol, okay, 5 milligrams of salbutamol. And I'll change it to this to the nebulization mask now.
Doc,
At the same time, Mr. Williams, I'll give you something through your vein called Nasis. It's a medication to allow you to relieve you of the chest.
I feel like I could die.
How do you feel, Mr. Williams? Can you hear me?
I don't feel well.
All right. So sorry about that. I will reduce your IV fluid at the moment. Let's see how well you're going to improve. Okay, I'd like to give you
I
something
don't
called.
feel well.
Okay, I'll give you something now called beta blocker with supplement through your vein. Okay, this will allow you to bring your heart rate down a little. Is that okay? Saturation is still high.
Sorry.
Okay. Moving forward now, Mr. Williams. I would like to
I
examine
don't
from.
feel well.
Tell me, how do you feel now? What exactly? Do you have? Are you still
I
having chest
don't
pain?
feel well. Oh, I
Something
can't breathe and my chest hurts.
Okay, I'll listen to your chest again. Okay, you're still having some difficulty in your breathing now. I might still give you another fluid of Lexis, but your blood pressure is low on the low side. Let's continue the fluid for now, Mr. Williams. Okay.
Move on to the next station.
All right. So what's wrong with this patient?
Oh, I can't breathe and my chest hurts.
Okay, so what went wrong in this?
I don't know, to be honest, because
You should know.
the problem is the respiratory rate was high.
Hmm?
This oxygen saturation was a bit on just a little bit low.
Okay. So what's
Yeah, it's irregular.
irregular? Irregular.
Yeah, but
Okay.
yeah. Should I have given digoxin for him?
Okay.
I'm just wondering honestly because I don't know if I can
So
give
you
something
gave the
like I
fluid.
did.
You gave the fluid. The patient became unwell.
Yeah.
Isn't it?
Then I stopped the fluid.
You stopped the fluid,
And I
but
gave
it was
Lexus.
already no. You gave bisoprolol.
I gave Lexus.
Yeah,
You
said
gave
beta-
bisoprolol. You did
beta
not give
blocker.
Lasix. Okay?
Yeah, he said beta blocker.
Beta blocker.
No, before that.
No, you did not say that. Okay?
Okay, maybe that was a mistake.
So
I assume I gave Lexus first.
no. So you did not give the beta blocker. Read just ECG. ECG was clearly atrial
Irregular,
fibrillation.
yeah.
Okay? So you need to give it to the patient. Consider that in the beginning, the patient initially improved. It was slightly hypoxic. You started the high flow oxygen. The patient improved.
Yeah.
Okay. The patient deteriorated after you started the fluid.
Fluid,
Okay. And then nothing was working for the patient, whatever you do. Okay. Because the patient's lungs are now fully loaded.
Congested.
Okay. Fully congested. You need to give the furosemide. Okay.
First.
Yeah, you could have propped him up slightly. Okay. If you have the bed control, you can do that. Otherwise, you can simply mention that I will raise the head and
Okay.
and take the fluid away, catheterize the patient. So all those things, that's very important. Okay. Now, in this, it's important that you look onto the monitor, look what the ECG is showing, not only just the numbers. Okay. What the rate, what the rhythm is, that's atrial fibrillation, irregular heart rate, then pulse and the blood pressure. If your patient becomes unwell after giving the fluid, that is definitely heart failure. Okay, that is definitely a heart failure patient. So, give stop the fluid, give furosemide, Lasix, and catheterize the patient and do all the investigation. Just mention less than troponin, echo, keep the patient refer to the cardiology and the medicine. Okay, so that's very important.
So can we, if the history says he already has MI, so can we avoid the fluids? Like,
No, it depends. So you need to follow the monitor, the
yeah.
findings. Okay, if the patient has a MI, okay, he may still be very stable patient.
Mm.
MI is different from the heart failure, isn't
Yes.
it? Yeah. So,
Can you show the infant?
you can. This is atrial fibrillation.
This is the first one.
The top on that's atrial fibrillation ECG.
Okay, so I have a question. So the initial blood pressure was low, okay, and then I saw the AFib.
Yeah.
Okay, so at that point in time, the chest wasn't clear. I don't want to give legs because the blood pressure was low already.
Yeah.
So I said, okay, I will start him on fluid to bring up the blood pressure.
Okay.
Okay, then we'll continue to assess him.
Yeah.
So what happened at that point?
So the blood pressure. So you could have in the beginning given the furosemide.
Even with low blood pressure.
Yeah, even with the low blood pressure. Okay. So because the patient is already has a congested chest.
Yeah.
Okay. The patient has a crackles. You could have given the furosemide in the beginning. Okay. It will increase actually the blood pressure. Okay. In the heart failure patient because the preload is already increased. So what you are trying to do is reduce the congestion from the lungs, okay, as well as the preload. The patient's breathing will improve. You could have given some salbutamol nebulization as well, okay.
Can I listen?
Okay, then for the rate control. For the rate control.
For the rate control, give beta blocker. That was enough. Okay, but why this did not improve? It was because you had given the fluid and you had not treated it all.
Sir, if the AFib patient is
You can give beta blocker for hypers.
hemodynamically
You
compromised,
can give beta blocker for hypers.
That's what he said. Doc, what did he say? What's your question?
yes, sir, if the AFib patient is hemodynamically compromised, so we are gonna shock him like DC cardioversion.
Yes, if the patient is unstable
Like in
hemodynamic.
this case.
Yes. No, you do not need to shock. The Simmons improve very quickly. If we are talking about the actual, yes, you may need to. If the patient is unstable, hemodynamic.
So only that the pulse is irregular. This pulse.
पहले स्क्रीन चली गई थी अब साउंड चला
इंटरनेट का
गया
मसला
देखिए
है
कौन सा कनेक्टेड है
दूसरा
डायरेक्ट तार लगाओ
So is there crackles?
yes, no surprise.
What is the sound like? What is the sound like? It's confused. It sounds like it's no. Not any. It sounds like
Okay, so you can spend. You will still be here. We got the people sitting online. You can spend time listening the sounds later. Okay.
he says that do it afterward. We have people waiting on.
I'm sorry. Yeah, I joined before so I don't know because the internet was not doing
Okay. Who is next? No, you can't. You came later, so you need to wait. Okay. Watch a few, otherwise you will say, "Oh, I need to watch a few." Otherwise, no.
Sorry, doctor, we
No.
really missed.
No. No.
Can I know?
Yeah. Uh, so wait. Okay. So this is your next scenario. Come and read.
32-year-old Mr. Newcomb is brought by the ambulance with severe shortness of breath while he was just having good fun with his children on a lovely bright day in a spring. You are referred to in an emergency department. Please talk to Mr. Newcomb, examine him, and manage his ongoing problem. At the end, discuss your diagnosis and management with the examiner. So 32, Newcomb, sudden shortness of breath. And I'm referred to. Okay, and at 2 minutes I need to
it. Yeah, to this time.
Disconnect.
Share a Zoom link if it's possible.
Internet is not working. Okay, let's carry on. You have already read the scenario, isn't it?
I'm Malia GMC
Begin.
77905152. I'm using the universal question. Hello? Hello, I'm Dr. Malia. I'm one of the doctor here in the department.
I don't feel well.
Okay, I can see that you are coughing a lot. May I confirm your full name, please?
The name is right, matching.
Okay, so what happened to you? Okay, I can see that you are coughing a lot. I need to observe your observation. Just bear with me.
Thank you.
I can see my.
Oh, I can't breathe and my chest hurts. Help!
Okay, I can see that you are not breathing well. Your oxygen level are a bit low. I need to do a quick assessment
you.
for you. Okay, just bear with me. So, can you just open the mouth cavity? Alright. By any chance, do you have smoker's cough?
No.
Okay. I'm going to give you some oxygen. Okay? Just bear with me. Okay, you will feel better with time. Okay? Okay. I'm going to examine your chest. Can you just take a deep breath for me? Just take some good breath for me. I can hear some added sound. I'm going to change the mask for you. Okay? Giving you some medication in it. 5 milligram of salbutamol, driven with oxygen. Going to order ABGs for the patient. Checking your pulse. You can see you're still coughing. Putting thin tubes into your vessels. Okay? Listening to your chest sounds. Heart sounds. Okay. How are you feeling, by the way?
I feel better now.
Okay, good to know. Okay, I'm going to order for you investigation with after passing this cannula. All right.
Thank you.
Okay. So. Okay. Going to check the pupil reflex for you.
Normal.
Scratch is coming. Okay, I'm going to examine your lower limbs and your tummy as well.
Thank you.
Going to cover you.
That's normal.
Okay, so how are you feeling now?
I feel better now.
Okay. Your saturation is also improving. Okay, that's good to know.
Thank
So,
you.
okay, I'm going to just continue this medication for the moment. I'm going to repeat it if by any chance you're still coughing or not improving. Alright? So, have you been diagnosed with any medical condition in the past?
Yes, doctor. I have asthma.
Alright. So, for how long you have been asthmatic?
For 10 years.
Okay. So, what were you doing when this shortness of breath started?
I was in the park.
Okay, so I believe that it must be one of the trigger acute attack of asthma. At the moment, I'm going to admit you. Is that fine for you?
Yes.
Okay, I'm going to involve my senior to come and have a review of you. Going to just continue the same medication, the oxygen, and we'll do some further investigations for you.
That helped.
Okay, are you with me?
Yes.
Okay, so is there anything I can do for you?
No.
All right. Once
Thank
you're,
you.
Okay, thank you. Welcome very much. Once you're discharged from the hospital, we will be doing, reviewing your medication as well.
Thank
all right.
you.
Okay. And we'll have a follow up for you. That why did you do? How are you doing with this asthma?
Thank you.
All right. So, my patient Newcomb presented to me with acute shortness of breath. On my examination, he was having shortness of breath and a high pulse. I, I talked to the patient, examined him, started my ABCDE protocol. When I examined him, his oxygen saturation was low. I put him after rolling out COPD. I started him with high flow oxygen. I listened to his chest. There was some wheeze. I put him on his 5 milligram of salbutamol. Reassessed the patient. His saturation started to improve. Right now, my recommendation is to admit the patient. Do some further investigation, which include ABG, chest X-ray, complete blood count. We'll review his medication. We'll talk about the trigger factors. We'll involve the senior. And once he is discharged, we'd like to have a review, like how is doing well, how is he doing at the moment.
Okay.
Thank you.
Okay, so this was good overall. Okay. However, there's you need to work on your presentation, how you present. Okay, you don't need to give every single finding. Okay, it should be just a 2 sentences, 3 sentences presentation. So your patient, Mr. Newcomb, you need to present following the SBAR technique, situation, background, assessment, recommendations. Okay, so you said you will recommend, you're not there to recommend, you get the recommendations, you are going to be the junior most doctor. Okay, so you will not recommend, so you will get the recommendations from the seniors. Okay, what the situation was, acutely unwell patient. Okay, so use the terms hypoxia because you are talking to the examiner.
Yeah.
So acutely unwell patient or very unwell patient presented hypoxic. On the background, he is 32 years old, non-smoker, known asthmatic. Okay, became acutely unwell while he was playing in the park. On presentation, he was hypoxic, borderline tachycardic, normal blood pressure. On my assessment, he has global V's, widespread V's, improved with the salbutamol, ipratropium, and steroids. I request a chest X-ray, ABG, all the blood investigations, including ABGs. Okay. My plan is to keep the patient in. I will go and discuss the patient with my team and get their recommendations. Just very simple. You do not need to tell every single number. If you want to say hypoxic, you can say hypoxic. But if you want to mention about the number, you can mention about maybe borderline hypoxia 92 with the oxygen saturation of 92 or 93% or 91%. Okay, but you do not need to tell every single number. Does it make sense? Any question? You want to ask anything?
No, I had a question, but I can't remember it now.
BP is stable, so we don't have to give fluid for this patient.
No. BP is stable, yeah.
You have to do it. I think it's true.
Can you tell us later?
But they will not be able to see. Your food is there. Your food is there. You want to start this one? Oh, thank you.
Sir,
Yeah, next.
if you don't get angry, can you please repeat the sepsis?
Huh?
Can you please repeat the sepsis at the end, which we missed? We will not miss again.
No, the reason is I don't get angry. So there are the multiple sets.
I know.
Okay, so sepsis, you will see more sepsis stations coming. Okay, I'm not angry for you being late. The thing is, if you see a bit more, then you will get time. Okay, yeah. So
We thought there will be a message.
For 10 minutes, you said 10 minutes.
We thought there will be something in
We were practicing.
we were saying
no, so all of you will get the time. So what's the point in getting anxious about it?
Next time it do happen,
We are not going to leave.
No, think about the people who are sitting abroad there.
Yeah.
and it's also important for us because we were waiting for this.
No, you will cry and I know you will start chasing me and then I will have to come and sit down. But they are sitting there for no reason at the moment. We need to consider. Ready?
I'm not ready.
Okay.
no.
You can put the tripod for them. No, you can put the tripod for them. Why?
Done?
Yeah.
You are FY2 doctor in the Department of General Medicine. You are called to see 65-year-old Mr. Patrick, who is feeling generally unwell. 2 days ago, he was admitted to the hospital with severe pneumonia. Please go to see Mr. Patrick and assess him. You are expected to manage him appropriately. Please perform necessary examination and investigations as you go along. At the end, give your nurse a definite management plan. Okay.
Begin.
I'm Dr. Shashwati Kantor. My GNC number is 7949485. May I please proceed?
Yes, of course you can.
Hello, Mr. Patrick. I'm Dr. Kantor, one of the doctors in the department. May I please confirm your name? Mr. Patrick, hello.
So he is coughing a lot.
Alright. Mr. Patrick, can you tell me your name?
Mr. Patrick.
Alright. My patient is verbalizing, hence his airway is patent. Mr. Patrick, can you tell me what's bothering you? Okay, Mr. Patrick, I'm just going to examine your chest. Okay, Mr. Patrick, I'm going to listen to your chest. Please bear with me. Mr. Patrick, I'm going to give you some oxygen. Please lift your head for me.
Thank you.
Okay, Mr. Patrick, I'm just going to hold your hand to check your circulation.
The refill time is 2 seconds, 2.5 seconds.
Okay, Mr. Patrick, can you tell me how you're feeling?
Same,
So, what?
slightly better.
Slightly. Okay, I'm just going to check your eyes. Can you open your eyes for me? Going to shine a light in your eyes. Can you please bear with me?
The equal and reactive.
Reactive.
Yeah, equal and reactive.
Okay, Mr. Patrick, I'm just going to check your blood sugar now. Can you tell me how you're feeling?
I don't feel well.
I'm going to listen to your chest one more time, Mr. Patrick. Okay, Mr. Patrick, I'm going to give you some fluids.
Thank you.
This might make you feel better. Give it some time, please.
That helped.
Alright, Mr. Patrick, how are you feeling now?
I feel better now.
Can you tell me what's bothering you?
You.
No. Okay. Mr. Patrick, I'm just going to check. I'm going to do your head to toe examination now. Please bear
Thank
with
you.
me. I'm going to expose your legs. I have a chaperone with me to ensure your privacy.
Nothing.
How are you feeling, Mr. Patrick?
Slightly better.
Mr. Patrick, I can see that you have a high temperature. I'm going to start antibiotics for you, and I'm
Thank you.
going to give you fluids. And I will.
Thank you.
And I'm going to give you oxygen. I'm going to collect. I'm going to do your EBG, and uh, I'm going to do your EBG and check your lactates, check your urine output. Have you had any problems with your wee
Thank you.
recently?
No.
Okay, Mr. Patrick, how are you feeling?
I feel better now.
Alright. Alright, Mr. Patrick, it looks like you're stabilizing a little bit.
2 minutes remaining.
Now what? I don't know what to do now.
Check your question.
What?
2 minutes remaining. Check your question.
Talk to the examiner. Okay,
Check
so
your question. Examiner or nurse?
please. Okay.
Nurse.
So to my nurse. So my patient, Mr. Patrick, was diagnosed with pneumonia, and 2 days ago, and he was admitted, and he came with breathlessness, and he had a high temperature and high and a low BP. According to my examination, I suspect that he has sepsis,
Okay.
and so now, according to hospital protocol, I will give him antibiotics, and I will also collect his lactates. I will monitor his urine output, and I will. I will monitor his urine output, and I will collect his blood for cultures, and I will. I don't know. I don't know now. I'm done.
Okay.
Move on to the next station.
So now in this scenario, you had no pattern,
Yeah,
no
I
control
know,
on the
I know.
ABCD.
Yeah, correct.
Okay.
I completely missed
So
out.
far, you have not connected the monitor.
Oh my god.
Okay. What's the pulse? What's the blood pressure? What's the ECG,
Yeah, nothing.
okay,
Yeah.
and you did not pay any attention to that.
Yeah.
I just wanted to see whether you think about it or not, that you need to check the blood
I
pressure.
thought there was
You need
something wrong with this.
no, you cannot simply assume
Yeah.
that. Okay. So this was for some reason I wanted you to say that you want to check the blood pressure, you want to check the temperature. Temperature I showed you just intentionally, but it was there for some time. You did not pay any attention to the temperature as well. So you need to focus on. And there was
I
no
got very
particular
flustered.
order. Okay. There was no particular order. A B C D E A B C D for all the problems. You need to follow that scheme. Okay. Airway, talk to the patient. If the patient is talking, then you move to the breathing. If the, examine the chest. If the breathing is normal, move forward, check the C, catheter refill time, blood pressure, temperature. So this is why we worked on, I talked on parameters. So the parameters should follow the sequence. Okay, catheter refill time, pulse, blood pressure, temperature. Okay, you should not move to the next one. If you stick to this scheme and follow the parameters, then you will not miss anything. When you're doing the C, you need to know what are the parameter that you're checking. You need to check all the pulses in the peripheries. Okay, you should not move forward to D without checking the blood pressure. Okay, because you know that these are the four parameters and you have not checked all of them. Okay, does it make sense? Any question? No? Okay. So this was chest sepsis pneumonia. Okay. And the patient had the crackles. You knew the temperature was high. Okay. What you could have done is given paracetamol as well. Okay. Paracetamol. That's one of the reasons why the patient is tachycardic. Okay. The patient is in shock, distress. So oxygen, paracetamol, IV fluids, IV antibiotics, blood culture, urine culture, sputum culture, chest X-ray, ABC. Okay. Everything.
Sir, if patient has urosepsis, we will change the catheter.
But not necessarily. Okay. Not necessarily. If the catheter is changed yesterday, okay. I don't think that we need to. If the patient is presenting with the urosepsis and the catheter was changed long ago, then yes. Okay.
So we need to ask, once we see the catheter, we need to ask the patient like when it was inserted.
Yeah, you can ask them when was the catheter placed or when was the catheter inserted, when was it changed last. Okay, is it new or the old? Okay, so these are not again the sepsis 6. You have more queries out of the sepsis. Okay, so the lifeline is a sepsis 6 protocol. Okay, A B C D E. No one is going to penalize if you do not say that you will change the catheter. Okay, the sepsis protocol is a A B C D E and treatment of the sepsis. IV fluids, IV antibiotics, temperature control, pain control, oxygen, lactate, blood culture, urine culture, chest X-ray, sputum culture, and culture of any fluid wherever it is coming from. Okay, so you do all those. Okay, and catheter change is a precaution measure. Yes, if you think that the catheter is conalized, then we can change it.
So what about the fluid of choice in sepsis?
Saline.
Normal saline?
Yeah, saline. Just read the notes is written there.
So when she was talking to the nurses, she was talking as if she's presenting to a doctor. I think you're supposed to give order. The question says give further instructions to the nurse. Okay, you keep an eye on the monitor. We've taken some of the sample, we sent to the lab for this.
So you need to these scenarios are created with some intention to see your different reflexes. They are different situations. In few scenarios it says at the end. In few scenarios it says at 2 minutes, so that your brain works according to the situation. Okay, and I look into that what you are doing. Okay, at the end means when you feel that you have done, you're done, then you talk. Okay, at 2 minutes it means that you have to follow that 2 minutes instruction. If it is a nurse, you talk to the nurse. If it is a patient, so there are a few scenarios that say at the end talk to the patient. In some scenario, you may see at 2 minutes talk to the patient. In few scenario, you may see at 2 minutes talk to the examiner. Somewhere you may see at the end tell you diagnosis to the nurse. At the end tell you a definite plan to the nurse. Okay, so you need to follow every single line counts. Okay, so the 1 minute that you spend outside reading the scenario, that is very precious. That's a golden minute. Okay, so this was the scenario was talk to the tell you the yeah. At the end, give your nurse a definite management plan, so which means that you had to talk to the nurse. Okay, at the end. Okay, does it make sense? Is the plan clear now? If you're talking to the nurse, you're talking as if you are a doctor, she is your junior. Of course, they know the medical terms, but they don't know about much about everything. Okay, so my plan, if you are my nurse, my plan would be so. Nurse, I've seen him, and he presented. I could see that he is quite septic. Okay, I prescribed the IV fluids and IV antibiotics. I've requested chest X-rays and given prescribed the paracetamol as well. Um, I will make sure that they happen. I will leave my bleep number. If you need any help, please let me know. Just continue monitoring the patient. Here you are giving some instructions and conveying the message as well. Okay, please continue monitoring the patient. If the patient deteriorates, please give me a call. Okay. So as if you are giving a plan to, and she has something to work on. Does it make sense? But if you are telling this to the examiner, say for example, I'm your examiner, you want to tell to me. So what you are doing is you tell that examiner, I saw a patient who's acutely unwell, septic shock. Okay, on assessment, hyperthermic 40.1. Okay, and chest is very correctly. To me, it appears a septic patient. So I've started the patient on high flow oxygen, IV fluids, IV antibiotics, according to the trust protocol. I've taken the blood samples for the group and save. Blood culture, urine culture has been requested, and chest X-ray and the sputum. I will take the sputum culture as well. Um, I will monitor the IV fluid and the urine output, and I will go and discuss with my seniors as well to find out if they recommend anything in addition to what I've already done. Okay, so this is how I do that. Okay, does it make sense? All right. Okay, so let's have some food because oven is not here. It's not. The microwave is not working. Actually, not here. So let's have a bit of food then.
Thank you very much for repeating this.
Straw? Oh, okay. Yes.
So can say about fluids, like when to give how much and how much
Dispensing is yeah, you
Don't
take
please.
IV fluids and IV antibiotics, you take blood
Really?
culture, urine culture, and
For me, I think the only place we give ringers is in
serum
OB-GYN.
creatinine.
In OB-GYN obstetrics.
Yeah, that is
Yes.
reduced.
That's what I know that we give ringers. Yes.
Guys, come on, come on,
Yes,
come on.
we'll check it out. That's the only place I know we give. In the Simman here. Whatever is normal for them.
who this man.
Can you guys hear me?